Hello, ladies and gentlemen. I trust that you're all keeping well. My name is Zina Nguru. I'm a counseling psychologist at Melchizedek Hospital. I'm excited at this opportunity to partner with Ponea Health and to bring you this exciting presentation on postpartum depression. Postpartum depression is a complex mix of physical, behavioral, and emotional changes that some women experience typically after childbirth. It is an experience that is also not limited to women, and some men also do report experiencing postpartum depression, and for the men, it's actually referred to as paternal postpartum depression. Some of the causes behind postpartum depression are hormonal fluctuations. We're also talking about issues of trauma and also the nature of the pregnancy, some of the unique factors surrounding the pregnancy and the childbirth process. Some of the risk factors surrounding postpartum depression, we talk about things to do with a personal history. If the lady or if the woman has a personal history of mental illness, either depression, bipolar, or any other mood disorder, if you're coming from if you're coming from a personal, if you have a family history of mental illness, if you're having problematic relationships, if there's lack of social support, those are some of the risk factors that have been identified where postpartum depression is concerned. Some of the ways that you can begin to identify whether you or a loved one could be possibly suffering from postpartum depression. Number one, it could be through observation. You may have observed that your loved one is having changes in their mood. They're having it could be they are a bit more irritable than usual. They are angry. They're having changes in their sleep pattern. They're either sleeping more or sleeping less. They are having difficulty bonding with the baby. Other than through observation, they may actually even report. At times, they may tell you that they're feeling a bit sad, more sad than usual. So those are some of the ways in which you can be able to tell whether you or a loved one are suffering from postpartum depression. So some of the common signs and symptoms that have been identified in postpartum depression is a low mood, a low and sad mood that is present all of the time, difficulty in bonding with your baby, you are irritable, there are thoughts of either self-harm or harming your baby. You may also even have suicidal ideations. Those are some of the common signs and symptoms of postpartum depression. Some of the practical ways in which you can be able to support your loved one dealing with postpartum depression is to, number one, to just be there for them. Your presence is everything. So when you're there for them, remind them to take their medication, avail them opportunities to be able to rest. Taking care of a newborn is involving, it is tasking in so many ways. So if you are able to relieve them even for a short while, that they may be able to go and get a break, go and take a shower, go and have something to eat, that would be important. If they are on medication, it would also be important to remind them to take their medication and just also provide a listening ear to their concerns and whatever else it could be that is bothering them. Ladies and gentlemen, it has been an absolute pleasure and joy bringing you this session. You can book my services through ponea.com. Thank you, and I look forward to hearing from each and every one of you.